Cystourethroscopy with ureteroscopy and/or pyeloscopy, diagnostic. The physician examines the urinary collecting system for diagnostic purposes with endoscopes passed through the urethra into the bladder, cystourethroscope, ureter, ureteroscope, and renal pelvis, pyeloscope. After examination, the physician removes the endoscopes. Cystourethroscopy with ureteroscopy and/or pyeloscopy, with removal or manipulation of calculus, ureteral catheterization is included. With lithotripsy, ureteral catheterization is included. The physician examines the urinary collecting system with endoscopes passed through the urethra into the bladder, cystourethroscope, ureter, ureteroscope, and renal pelvis, pyeloscope, and removes or manipulates a stone, calculus. To extract or manipulate a calculus, the physician passes a stone basket through an endoscope. The physician inserts a ureteral catheter and removes the endoscopes. Report 52352. If the physician passes a stone basket through an endoscope to extract or manipulate a calculus. Report 52353. If the physician passes an electrohydraulic lithotripter probe through an endoscope to pulverize a calculus. Cystourethroscopy with ureteroscopy and/or pyeloscopy, with biopsy and/or fulguration of ureteral or renal pelvic lesion. The physician examines the urinary collecting system with endoscopes passed through the urethra into the bladder, cystourethroscope, ureter, ureteroscope, and renal pelvis, pyeloscope, and takes a biopsy and/or uses electric current, fulguration, to destroy a ureteral or renal pelvic lesion. The physician may take a biopsy of suspect tissue and/or destroy a lesion with electric current. The physician removes required instruments and endoscopes. Cystourethroscopy with ureteroscopy and/or pyeloscopy, with resection of ureteral or renal pelvic tumor. The physician examines the urinary collecting system with endoscopes passed through the urethra into the bladder, cystourethroscope, ureter, ureteroscope, and renal pelvis, pyeloscope, and excises a ureteral or renal pelvic tumor. The physician inserts a cutting instrument through the endoscope and excises the tumor. After flushing the area with saline solution, the physician may insert a ureteral stent. The physician removes the cutting instrument and endoscopes. Cystourethroscopy with ureteroscopy and/or pyeloscopy, with lithotripsy including insertion of indwelling ureteral stent, e.g., Gibbons or double J type. Cystourethroscopy with incision, fulguration, or resection of congenital posterior urethral valves, or congenital obstructive hypertrophic mucosal folds. The physician examines the urinary collecting system with a cystourethroscope passed through the urethra and bladder, and incises, excises, or uses electric current, fulguration, to correct defects of the bladder neck or the back of the urethra. Cystourethroscopy with transurethral resection or incision of ejaculatory ducts. Cystourethroscopy, with insertion of permanent adjustable transprostatic implant, single implant. Each additional permanent adjustable transprostatic implant. Through the urethra, the physician performs a transurethral resection or a transurethral incision of the ejaculatory ducts, TUED. The cystourethroscope is introduced into the meatus and the urethra is inspected. Instruments are inserted through the cystourethroscope to the region of the ejaculatory ducts. The seminal vesicles are compressed and the ejaculatory ducts are incised with a hook electrode or resected in one bite with a loop electrode. The seminal vesicles are again compressed. The area is observed through the scope and the instruments and cystourethroscope are removed.